Centuries ago, people with epilepsy were burned at the stake. The barbaric practice did not cure epilepsy. The condition still exists today. Medical advancements, public awareness, and patient education have taught us that there are productive, long-lasting solutions that help patients manage their seizures. The days of witch hunting the mentally ill and those who suffer from cognitive deficits must also come to an end.
Hi, Mom. If you listen, please call me back. I'm having a hard time right now. Please call me back.
Minutes after receiving that mental health crisis call from my son, he was arrested for disorderly conduct. Jailing patients with mental illness or cognitive deficit does nothing to cure or prevent them from having the symptoms of their illness. It prolongs and worsens them. Imagine if you got blamed for having cancer, or epilepsy, or diabetes. Imagine this unthinkable scenario. You or your loved one needs emergency assistance. When help arrives, the first responders aren't equipped to test your blood sugar levels. They do not carry a defibrillator or a portable EKG. In fact, an ambulance never arrives. Just a squad car with flashing lights. At your most desperate time of need, you are further traumatized and stressed as your condition worsens. Now imagine every time your medical condition became critical. Instead of this, you got this. Repeatedly denying emergency care and then criminalizing mental illness upon a mental health crisis is just wrong. 1 in 4 adults has a diagnosed mental health condition. Chances are that includes either you or someone you know. 61.5 million Americans have been diagnosed with mental illness. Nearly 1/3 more than there are those with epilepsy, cancer, and diabetes combined. The number of seriously mentally ill in our nation almost equals that of cancer alone, and is only surpassed by heart disease. The numbers drop down to 1 in 10 for our children, but don't breathe a sigh of relief quite yet. Many states arrest kids as young as 5 years old. Our current method for handling mental health crisis is a revolving door of offenses, arrests, and court appearances, all at the expense of the taxpayer. And as we have seen in recent years, the results of this method can be devastating. But what if there was another way? What if every time someone with a mental health crisis called emergency services, a first responder with crisis intervention training, CIT, was dispatched? What if there was Mental Health 911? Casualties of the social stigma of mental illness would also benefit. Those who suffer from autism, brain injury, and mental retardation would receive immediate care instead of jail. Other benefits to Mental Health 911 would include a relief on the prison system, removing the burden from law enforcement by taking the guesswork out of determining the difference between a true mental health crisis and criminal activity, providing continuity of care, the opportunity to diffuse a situation without the need for hospitalization or jail, a reduction on the financial burden on the system in costs associated with jails and courts, the ability to identify, diagnose, and treat those with a mental illness, the potential for reduction on vagrancy, homelessness, and crime, the potential for a return to society as a productive member, and a safer environment for patients, law enforcement, and society. With Mental Health 911, patients could go to crisis centers, psychiatric hospitals, or mental health facilities instead of jail. Then this might look like this. Help would be within reach, and healing could begin.